You're listening to Health Professional Radio. I'm your host, Patrick Reyes, and on today's show we have David Meldrum. Now, David is the National CEO of the Mental Illness Fellowship of Australia. Welcome to Health Professional Radio, David.
Hi, Patrick.
So, Mental Illness Fellowship of Australia, or MIFA, doesn't really tell us much about what it is your organization does. Can you tell us more about MIFA?
Well, it does tell you a bit because we focus on helping individuals and families who are dealing with illness. Particularly our strength is with serious mental illness. So I suppose probably 3/4 of our participants in many programs and their families and carers, we're dealing with the issues around quite serious mental illness, including the psychotic illnesses.
And does your organization operate throughout Australia?
Yes, we're a federation. We've got 10 members at the moment, and collectively we've probably got about nearly 2,000, I think around 2,000 staff and about 1,500 trained volunteers. And on any given day, we've got about 10,000 people participating in one of our programs out of any one of about 150 locations in every part of Australia.
Wow, that is a lot of people. So we do know that there are more than a couple of mental illnesses. Which ones would you say are some of the common ones in Australia?
Well, it depends where you want to start. If you go to the Diagnostic Statistical Manual, which is the big sort of Bible used in this area, there's something like 4 million Australians have got a diagnosable mental health problem at any given time. You go down to the other extreme, how many people have severe and persistent mental illness with complex disabilities and so on, you've got about 60,000 people. So take your pick along that continuum. If you're talking about people whose lives are significantly affected and disabled by quite serious mental illness, there's at least a couple of 100,000, and some people would say as many as 600,000.
Wow. And can you give an example of how you guys would work with, say, families or friends or carers? Well,
we work largely outside of what you might call the medical sphere, and so a good chunk of people's experience of serious mental illnesses might well be what they might call a breakdown that might end up involving being in hospital, or certainly with a GP, possibly with the police in an emergency department. And in general, they would get competent care and help with the things that medicine can deal with. They then, if they were very lucky, would find their way into a competent, slightly broader-based community mental health service with nurses and psychologists and OTs and so on. That's where it has tended until very recent years to stop, and yet there are a whole lot of other issues to do with the family, with employment, with housing, with a social life, and with wider physical health issues that tend not to have been well looked after. And that's our zone. That's where we work, particularly with individuals and families in trying to put a quality of life back together.
I see. Now, our listeners are clinicians of one kind or another. What message would you like to leave them as being on Health Professional Radio today?
Well, when you've got somebody who's obviously deeply impacted by a mental illness, think beyond the clinical. There are very good services out there like ours. We've got a national hotline, for example, and I can give you the number: 1-800-985-944. That's 1-800-985-944. And anywhere in Australia, that will get you to one of our member organisations, which is nearby somewhere. And we guarantee that they are people who will understand about mental illness, particularly serious mental illness. They'll be able to put you in touch with people who maybe are dealing with exactly the same issues as at the moment, and they'll also be able to put you in touch with all the services that are available in your area. So, make the link is my key message. Make the link to beyond clinical services, because people are trying to put a life together beyond the actual management of the mental illness itself.
All right. And other than that phone number that you provided, is there a website that our audience listeners can go to?
Yes, you can go to MyNetworks, mynetworks.org.au. You'll find lots of extra information. If you're a GP, When you're typing in the word schizophrenia or bipolar or mental illness in the family, you'll find on your sidebar there's some information sheets there labelled My Networks, which are very useful, and will link people to services like ours anywhere in Australia. We're not recruiting for clients because we'll be telling people all the good quality services available in the area, not just ours.
Right. All right. And now a favorite question among or within Health Professional Radio is, what is the biggest misconception that keeps you awake at night that you would like to clear up a bit?
That's a very good question. I think it's probably not so much a misconception as a very common perception in the public that somehow this is not a lot to do with me. Every family's got somebody in it with a mental illness. Every family has got someone nearby with a serious mental illness. Every classroom's got a kid in it who's got a parent with, even a psychotic illness. Every high school with 1,000 kids in it has got 30 or 40 kids who are going to develop psychosis in the next 10 years. This is not them, it's us.
All right, David, thank you for taking time out of your day to join us today. It was our pleasure having you on Health Professional Radio.
Thanks, Patrick.
Yep. So now, if you've missed my conversation with David Meldrum, the National CEO of the Mental Illness Fellowship of Australia, there is an audio file on both YouTube and SoundCloud, and you can also read a transcript of this conversation on our website. And thank you for joining us today.